Hi everybody, it's Dr. Preston, naturopathic doctor here at Beachside Naturopathic Clinic in Sunset Beach. Wanted to provide some updates on the COVID-19 and give you guys some information on all the new stuff that's coming out, which is super hard to keep track of every day because it's constantly changing. So just want to put that out there that what I say today may be totally different in another week, unfortunately. And that's because we're just constantly learning things about it every day because it is a new virus. Everything that we did know came from China, and now that there's so many different countries, different cultures affected, we're constantly seeing things shift. So right now, you guys know the main stuff about SARS or COVID-19. So COVID-19 is the actual disease process in humans. SARS-CoV-2 is the actual virus. So if I use that interchangeably or you see that, maybe that's helpful in understanding what they're talking about. So right now, we're seeing it affect still largely elderly people, men, and people with comorbidities. So again, the difference though with that is that understanding a lot of people can be infected. That's a huge risk with that, but there's also the risk of death, which we are seeing higher than the normal flu. But the risk of infection seems to be about the same. So the risk of death, of course, is going to come with our elderly patients over 65. And again, our comorbidities. So that's a lot of times with people with hypertension, cardiovascular disease, or kidney disease. Okay, so I want you guys to understand when we hear maybe about a young person getting it, unfortunately, that's because a lot of young people have undiagnosed hypertension, right? Those are the populations that's not going to the doctor, they feel fine. And they can have other undiagnosed issues just because they're young and they're asymptomatic. So this comorbidity issue is a big, big deal as far as being infected and having increased risk of death, okay? Because most of us will find that we are infected and we're carriers, okay? So this is, this also brings up the mask debate. So we're all being asked to wear masks right now. The CDC says yes. The World Health Organization says no, it doesn't make a difference. Dr. Fauci is saying yes, wear them. So we're kind of seeing conflicting ideas, but the main thing that I want to address is that it is important in protecting others, right? So it's not really protecting yourself. It's protecting others, people that are immune compromised or have these other comorbidities. So that is why we want to wear the mask, but that is the main reason. It's not going to protect you, okay? We're also seeing kids not being affected, okay? And there's a lot of reasons for that. One is that a lot of times kids have been exposed to different strains of the coronavirus. So it may be that maybe they have some innate immunity. The other thing that we're seeing as far as correlation, meaning decreased risk of infection and death, is with people that have increased melatonin. So we know with kids and children under 9, they have a lot of melatonin. They're sleeping a lot, and that's what makes them healthy. We'll find that melatonin is actually really good at fighting inflammation, which is a main trigger of the pneumonia part or the respiratory distress syndrome that comes with COVID-19. So let's talk about how that process happens, okay? So the COVID-19 process can actually start shedding within 5 days within the throat. Not everyone has throat symptoms, sore throat, but this is where the shedding can occur. So when we have the shedding, that's why we recommend here doing propolis sprays, hypochlorous sprays, any kind of immune spray in the back of the throat is a great preventative tool because that's where a lot of the shedding can start. Maybe you have a little bit of a cough, allergies are going around too, which we did another video, but that may, it makes it kind of hard to differentiate at the beginning what exactly is going on. But so how this virus works in our system is pretty fascinating. And this is really what makes it different than a lot of the regular flu viruses. So COVID-19 or the SARS-CoV-2 has actually figured out how to use a process that we normally use in our body. So we have in every cell wall, we have a type of enzyme protein called furin. And furin goes around our body and activates a lot of proteins. So we all have proteins in our body that do a lot of function, every function. If those proteins were active all day, every day, we would be using up oxygen, all our resources, we wouldn't live long. So our body has these proteins called furins that go around and cleave and activate these dormant proteins. Well, COVID-19 has figured out how to hijack those proteins. So the virus will actually use these furins to activate itself and allow it to get into our cells, okay? So this is where a lot of anti-furin therapy has come around. In fact, a lot of it started with the HIV research because the HIV/AIDS virus uses this same mechanism. So if we look at anti-furin therapies, there are two effective therapies against this type of activity. One is vitamin C, and the second one is andrographis, which is a great antiviral herb. I've used it years and years here at the clinic for other viruses. So those have anti-furin activity. Now, it hasn't been specifically studied in large amounts against the specific virus, but it is something that, again, that we're using to kind of help prevent or help lessen the duration of an illness. Okay, once this virus hijacks our furin, gets into the cell, then it starts to, this is where we see this, what we call this cytokine storm, or that's when we start to have all the symptoms. Okay, and this is because it releases a substance called inflammasomes. Okay, so inflammasomes is what we actually feel as inflammation. Okay, this is when we feel sick. This is the immune response to this virus. All right, and that's what makes it lethal. So this inflammasomes then creates what we call a cytokine storm. We have an overt, an overt immune reaction, and what's actually us poisoning ourselves, if you will, in response to these inflammasomes. Inflammasomes actually create this lung issue. It starts plugging up, creating a lot of inflammation, and can start creating this hypoxia that we hear, this low oxygen. And this is the state where the viruses is making little babies inside of our cells, and they're getting ready to send them out, and then they'll go and infect more cells. Now, how this is made is the virus inside the cells activates another protein called viperins. This allows the cells to be more permeable by activating calcium channels, which allow those babies to go out and start spreading. Now, an interesting fact on what does the same kind of thing are radio waves. So radio waves also allow calcium to go into the cells, which make them more permeable. So this is why I'm telling people to make sure they're staying away from their cell phones right now, putting it in another room, turning off their Wi-Fi at night, all of that. Melatonin, nitric oxide, again, vitamin C, help modulate those inflammasomes. So this is another reason, just a causation. I've been taking melatonin at night. You really have to start it early, meaning like 2-3 o'clock, and then you do want to do time release. So overall, the outlook, I kind of look at it in 4 different ways. We can try to prevent with herd isolation. So by all of us isolating ourselves, we're not being exposed to it, we're not hurting other people, but we actually have, it's more detrimental to do that, what I'm seeing in the long run. No food, no delivery. The more we start seeing things every week. Now don't go to the grocery store this week. That's not sustainable, okay? We worry about the elderly. We're seeing people with social isolation, with cognitive decline, go down really fast. Second is we can try to prevent with a vaccine. Okay, right now though, it has a poor track record of really doing anything, and if it's coming out, they're talking about not going through phase 2, not doing any human trials, just getting out there. And I don't know about you, but I don't want to be an experiment. The third one is preventing infection by using non-toxic measures, which was what this lecture was about. The fourth one is creating true herd immunity. This is kind of, I think, what's happening now. When we were late to the party, is that it was already kind of spreading. So by all of us being exposed to it, we're lessening the effects that can happen, and we continue to spread, and people that are infected and don't die, now they have the immunity. So overall, we just have to think of the financial, social consequences are far more astronomical to me than the deaths that we're having now. Anxiety, the depression, the suicide rates. We're seeing people's relationships impaired. So that's my outlook on all this right now. So I hope this helps.